Good evening everyone. I am Dr. Nafis Rahman Purna from Bangladesh. I am a master student of AUSN and also working as an intern doctor in Purna Medical College Hospital of Bangladesh. My topic is ethical aspects of evidence-based and lab investigation-based diagnosis in developing countries. Let me ask you something. How much money did you spend doing lab investigations last time when you were sick? And how did you feel when you found that the report was absolutely normal? You were happy or you became angry? Okay, let's see the same scenario from a doctor's point of view. Here we can see a triangle which shows a patient, clinical procedures, medical history and physical examination, laboratory and diagnostic tests and procedures. There is an interdependence between these three things, and this is the main point to reach a confirmed diagnosis. Here is another diagram which shows the link between knowledge about disease, which is evidence-based medicine, and recommendations, guidelines, and my books, manuals, textbooks and other journals also. Here is patient's problems, then again medical history, physical examination, then a working diagnosis, then there are many differential diagnoses, and then we have to do the laboratory test and ultimately the confirmed diagnosis. Here is another diagram which shows P for patient's problem, D for definition of symptoms, and T for treatment or therapy, and E for evaluation of the treatments. We can see some common laboratory tests that indicate some common disease, such as glucose tolerance test for diabetes, hyperglycemia, hypoglycemia, diabetes insipidus, creatinine and urea for CKD, complete blood count for anemia, leukemia, leukocytosis, thrombocytopenia, and some other tests. We can see laboratory screening test for disease posting public health problems. Laboratory diagnostic test, breast ultrasound mammography, thyroid stimulating hormone test, prostate-specific antigen, carcinoembryonic antigen, alpha-fetoprotein, papillomacular test, which is done for the C cervix. Here we can see a picture of one of my patients suffering from tuberculosis who came to our hospital with a problem of low-grade fever, cough and weight loss for more than 1 month. And we took proper history from that patient. And after that, we took the clinical examination, and we couldn't decide that as the patient is not economically solvent, should we give him a lot of investigation, or should we start the treatment of pulmonary tuberculosis empirically? So what do you think? In this case of patient, should we consider the financial condition of the patient, or should we start the treatment? Let's travel back to the history. When there were no lab investigations, people used to go to the local doctors, and the physician tried to do all the things within one setup in his own chamber. But now the scenario is different. Let's consider some questions. Is the test specific for the professional diagnosis? Is it specific for the disease? Is it appropriate for the patient? Did I consider the economic status of the patient? Do the patient have consent? How painful the process of the test is? From where the test will be done? Will the report of the center will be accurate? Let's discuss these points. Always consider this question: is this test specific for the professional diagnosis? A disease may have many more specific diagnoses, or some may not have any. So that's the point. Which specific diagnosis is specific for which disease, and how many tests we should give to the patient considering his financial condition or his other conditions. Is it appropriate for the patient? It's important to know whether the patient is fit enough to do that lab investigation or not. Some investigations are urgent to confirm the diagnosis, but some can be done later. So it's necessary to decide it ethically, because one report can change the total treatment procedure, and the proper treatment is the only need of a patient. Another thing, we should consider the economic status of the patient. As we are discussing about a developing country, before giving any advice, we should have some idea about the financial status of the people. Let's see a picture of Bangladesh as an example. Bangladesh is one of the world's most densely populated countries with 150 million people, 31% of whom live below the national poverty line of $2 per day. So how can a poor person afford the cost of these lab investigations, which are almost double of his daily income? Then from where the test would be done? It's really important for the physician to choose the right place to do a lab test, because the accuracy of lab test depends on some factors. She should keep in mind all this. Some test needs to be done in an optimum temperature or in a proper environment. Sometimes all the facilities are not available near to him. So does she has the right to suggest the patient to do the investigation from a lab which seems better to him, or she should just tell him to do all the tests from any place which is available for her? There is another point of false positives and false negatives. Another issue is that the result may not be 100% accurate, and it is not known by the physician either, or not by the patient also. Is there any proper system that the physician will be able to monitor it by herself? Some disease needs proper monitoring, because one result can change the total life of the patient. Every patient must have quality health care, and that's the ultimate duty of a physician. But ensuring it is not that much easy for the physician. It would be helpful for her if she had any specific parameter or instruction about advising a lab investigation. Then we can talk about referral system. All investigations are not available in the rural or remote area, so the patient has to be advised to do this from a higher center. But during the treatment process in that remote center, if she had done a lab investigation, isn't it necessary to keep them properly and sending them to the higher center, so he doesn't need to do it again? This can save his time, effort and money also. So maybe it's high time to make an ethical guideline about the referral system of lab investigation in developing countries like Bangladesh. Finally, I want to say all these things are actually teamwork. The accuracy, speciality and sensitivity of laboratory tests have been increased significantly, but clinicians define definitive diagnosis through a complex process that is based on medical history, physical examination, laboratory and other tests, their own knowledge and experience. Communication and close cooperation between clinicians and different laboratories are necessary in daily work. And modern diagnostic process is based on teamwork. All team members should strive to the same goal, and each member should know the basic work principles of all other members. And that's the main thing. And that's the whole topic was all about ethical aspect of evidence-based and lab investigation-based diagnosis in a developing countries. And maybe I am the youngest member of AUSN, that's why my presentation was the smallest. Thank you.
Thank you. So you like lots of questions. Any comments or questions?
I just want to congratulate the young lady. She's done a great job in bringing to the front some very critical questions. Do I have to worry about how much the cost is going to be while I'm in hospital, or do I worry about my health? And even in families, we feel the burden about the cost of medical care when someone is ill. And sometimes we have the benefit of having bigger families and people helping, but what happens if you're alone and you don't have the support? In South Africa, we have the case of where cancer patients were being turned away from government hospitals due to the lack of oncologists in the hospitals to provide specific treatment, even the treatments that needed to be ongoing, and even the diagnosis and so on and so forth, some of the laboratory tests that needed to be done. So this is a very relevant topic for us, and I hope you take this further and we get to read more about it in your work.
Thank you, ma'am.
Okay.
I want to ask one question regarding that. You said that if you go for a test and when the reports comes, it say all okay, and then we realize, oh my God, they have taken my blood, my money, my time, and this is the image that, or I say that paramedical companies or they have created, that you should have checkup in 6 months, 1 year, you should have a full body checkup. And this, they have a special offer also. So you are a doctor, so if you can suggest something to have, like, do we really require a normal person without afraiding from that virtual image that you need to have a checkup for 6 months or 1 year, you should have a checkup. So how you want to advise us regarding this, so we can be safe from this evidence of lab testing?
Thank you. It was a nice question. I just want to say that yes, you can do your checkup, but at first you can consult with a physician. Then he will advise you. You need to do any checkup or test, and that's the main point here. That we physicians don't have any guideline that to which patient I should give these specific investigations. I will give you a list of investigation and you have to do it. It will be a burden for it. But if I know that I have to give you this investigation, your financial status, it is appropriate for you, then it will be the best decision, I think. Thank you.
So here comes the medical ethics.
Yeah. Nafis sir, your title is very good, but I want to say what types of ethical issue in here your ethics belong to physician or laboratory, or who's those field paramedics? Who's your main point of target? Tell me.
My main point of target is to make a guideline. The authority should make a guideline for the physician, so that the physician can give appropriate investigation for the patient.
But lots of doctors are malpractice, so that's why I complicate this point. Ethical is only one point. I think you move on specifically, how physician or paramedics or laboratories. But you combine 3 parts, not a complicated 3% ethical issue. Quickly recover this issue. So regarding your title, it's very good, but I think only one person is a big issue. You move on for future, so it will be benefited.
Thank you, ma'am. I'll consider it next time.
Thank you.
So I'd like to give Nafis. I give you an example. In some countries, the National Health Insurance Scheme identifies useful diagnostic criteria and diagnostic tests. And at the national hospitals only allows patients to use the tests which have been judged to be appropriate. That's one option. So in that case, your bill, when you look at it, is maybe zero because the government's paying for it. Okay? Or your co-payment may be only 10 or 20%, so the government is paying. So that's one case. So that's the government limiting. But in that case, they may say, well, if you come to this hospital, we will not perform other diagnostic tests except the ones on our list. If you want some other tests, you need to go to a private hospital and pay what you like.
Yes.
Yeah, so it's integrated, which overcomes one problem that you had mentioned. A second system is, I know in the compulsory health insurance scheme in the United States, under Obamacare, everybody is required to have health insurance, and they have to pay a tax penalty if they do not get health insurance. But it subsidizes low-income earners, and that in that health insurance scheme, you also have a free public health examination. So I did this last month, and then it's very happy for me to look at the bill, because the bill I received, everything's paid by the health insurance, and my co-payment is very, very small, maybe $0.0000, $10, $0.00. So everything's paid. So, and yet the costs on the form may be several $1,000s of tests that are being paid by the government. So it's good that people understand the real value of the cost, because in many countries the costs are not shown. But it also, they tend to try and get extra tests to the patient, saying, don't you think you need to test your vitamin D? Maybe you didn't get enough sunlight. And then that will be an extra $100, but they won't tell you that it's going to cost extra money. They just do all the tests and then add in a few extras. Okay. So this is another system. So do you think it's compulsory public health screening that the government is paying is a good thing for everybody? Because I don't need to pay for it. So we can have different ethical issues of the costs. Because if I'm a totally libertarian, I may say, I don't want to pay tax health insurance. I just want to pay my costs. And I don't want to look after you or him or other people, only myself. But a health system where we have to pay into it to share the burden, then it's on the ethical side of solidarity, saying we need to share. So which is, what's the ethical solution? If you were Minister of Health, what would you do?
Thank you, sir. Regarding this question, firstly, I want to say that in developing countries like Bangladesh, we don't have any health insurance. We have to pay all the bills by ourselves. And the main point is some of our patients come to us and we give them list of investigation. Maybe they have to sell their property, they have to borrow some money from others. So it's likely some burden for them. And your question you are asking me, so what should I do? Is it okay to give them this if the government is paying the bill? I think a physician can give them to regular checkup, but you know there are some invasive tests which may be burden for the patient when government is paying the bill. So physician shouldn't give them the invasive test, but they can give them some tests which are not invasive, which can be done easily, like ultrasonography or some kind of X-ray, radiological test. This can be done. Thank you.
Thank you. But actually I know in Bangladesh, if I'm a government worker, I have health insurance. Yeah? If I'm a government worker, I have health insurance. If I join some university, I have health insurance. So you actually have a class where some jobs have health insurance and other people do not. Certainly most of the transgender disadvantaged group that we just heard about it would not. So we actually have a tiered system, is that right? So some may get health insurance and some don't get health insurance. But
I would like to reflect some of my experiences here.
Yes.
yeah.
Thank you, Purna, Nafis, for your nice presentation. I think most of the developed countries will not understand this issue who have health insurance in their country, because most of the investigations are done at the cost paid by the insurance companies. But in case of Bangladesh and some other countries where health insurance is not that much available, this scenario is totally different. Because there are some screening tests. If you do them right now, maybe you will be positive. Like if you screen for tuberculosis, I guess in most of the persons of Bangladesh will be tested positive. Because tuberculosis is so common in our country that almost if you are healthy but still carrying the tuberculosis bacteria within you. So it is important to have a regular checkup. But if you don't have the insurance, so this checkup may be a burden for you. So unless you get sick and come to the hospital, most of the time you don't want to get checkup regularly because you have to pay the bills. So when you are ultimately sick and come to the hospital, maybe the disease has progressed so far away that it has become difficult to diagnose. Is it a tuberculosis, or is it lung cancer, or is it lung abscess, or anything else? So, and in that phase, we have to give the patient a list of tests, like you have to test for tuberculosis, you have to CT scan of the chest, whether it is chest X-ray, whether it is malignant or anything else. So in that case, that would be a burden for the patient also. So if you are doing regular checkup, that would not be a fact, because it would come earlier. So in case of health insurance, the government or the health insurance company is paying the bill. So you are okay with that. But if you are not under the coverage of insurance, that is a burden for you. And in case of countries like Bangladesh, no one is pressuring you to have health insurance. So most of the people we experience, we conduct, they don't have health insurance at all. So there is a ethical issue. As a physician, I feel like should I give the patient a CT scan of the chest, because that would cost around 400 or 5,000 or 4,000 taka, Bangladeshi taka. That is a lot for the patient. Or should I start empirical treatment of the tuberculosis and see the response, whether the patient is responding or not? But if the patient is not affected by tuberculosis, and I see empirical treatment start for 1 month, and after 1 month I see it is not tuberculosis, it is something else. In that 1 month, the patient has already developed further, or maybe it has metastasized to another part of the body. So what was my ethical point? Should I do it earlier when I had the chance, before it has been metastasized, or should I? It was better for me to wait it. That I waited for 1 month. But ultimately, I have to give the patient the test. So, is it ethical to consider the financial condition of the patient at first, or should I give them the test? So, of course, it is a very ethical dilemma for practicing in countries like Bangladesh, where there is no health insurance.
Thank you. Yep.
So my one question is that about the Bangladesh, because I am also working in the tuberculosis, that's why my concern is that there is recently they have conducted the prevalence survey study in the tuberculosis, and estimated the incidence was slightly increasing than the other it was estimated. So, and I think it is almost free for the tuberculosis. And now the gene expert technology has started to find out the MTB detection with the recombinant hospital test at the same time, and it is also rapid diagnosis. So I think it is the free of cost in the Bangladesh also, and for the benefit of the patient. And why not doing that the gene expert technology for the patient first? And it is free of cost, because the WHO and other agencies are supporting for the tuberculosis, because it priority one disease all over the world.
Yeah. And regarding your question, gene expert technology may be free, but it's not available everywhere in the country. So, if I am practicing medicine somewhere out of my capital, there is no availability of gene expert test. So ultimately, if I give the patient gene expert test, he or she has to go to the capital and do the test there. So ultimately, it will cost the same. So it's not available everywhere.
Oh, microscopic
Microscopic, that is available, but sometimes we do ADA test. So in most of the diagnostic labs, they give us the result that ADA is positive and lymphocyte is 100%. But we never see lymphocyte count below 100%. So how do we rely on that test? Because there must be a patient with lymphocyte count 99%. Why are always there is 100% lymphocyte count? So we cannot rely on them as well. So yeah, that's the problem if you are doing investigations from outside of the capital. and there are lots of investigation centers, and they are not maintaining their standard as well. So there is problems.
Thank you. Yes, behind me.
From an indigenous knowledge perspective, when we've engaged with the traditional health practitioners, I understand the question from Ketan about going for regular checkups, and you are proposing that regular checkups is good, and so is Rajiv is emphasizing that regular checkups is important to catch or to prevent the disease from progressing further. And our traditional health practitioners have indicated that their way of dealing with health and healing methods was more from the preventative medicine perspective. There's not so much about treatment. They can treat, but their mechanism was to prevent, and hence it is, I think, where more conventional medicine is going now, to try and find ways to prevent disease progression or even its initial onset. So if you have other issues in your body, it can cause complications and manifest as whatever, diabetes or any other disease for that matter. So in that way, I think if we speak to indigenous health practitioners, they might even say yes, regular checkups is a good thing, from their perspective, because it helps to prevent disease state. So yeah.
Okay, last comments, please, Nafis.
Okay, thank you, ma'am, for your comment. All I want to say, yeah, prevention is better than cure. But as perspective of our country, most of the people come in the 3rd or 4th stage. So that's why we have to do all these steps. And that's my point is I want a guideline from the authority that which test should I give to which patient. That's the main thing. Thank you.
Thank you very much.